So the treatment of metastatic disease and how we handle patients with metastatic disease is much different. And I always remember this case, and I always will tell this to people, that, this was probably like 15 years ago, and I had a new patient coming to see me, and she was late for her appointment. It's like an hour and a half late, which for my practice is actually not bad, as you know, because we're really busy. But the thing is that, so she came in late. I said, why were you late? And she goes, because I was picking out my tombstone.
Oh.
Yeah, and so she said, and she had ER-positive breast cancer. That was probably a few bone mets. That was it. Not a lot of disease. And I think part of what we have to do, when people come in the door, and you know this too, I mean, I'm curious to hear your opinion about this, is that we got to kind of tell people that you may have something that's not curable, but you have something that's controllable for a long time. And I think, again, my view of cancer and kind of what it is, the reason people die from breast cancer is that your liver gets filled up with cancer, or your brain gets filled up with cancer, or maybe occasionally your lungs get filled up with cancer. All right, and we can't, and it keeps growing, and you get liver failure, or you get brain problems, and that's it. Having disease in your bone doesn't kill you. Occasionally it could, God forbid, but it usually doesn't. And having a few scattered lymph nodes and 1 or 2 liver mets that are really small doesn't kill you. And our job is to keep those stable. We may not get rid of all of them, but to keep them small for as long as we can, to give you as decent a quality of life for as long as we can. That's kind of what I tell people, and you know this. I mean, what do they say to you about this? They'll say, I'm going to die, that's it. What do they tell you with metastatic disease?
Patients really can be very anxious about upcoming scans.
Right.
Very anxious about what they're going to find. I think most of the time they want to hear that everything's gone. But we try to just let them know that, again, stable is good.
Stable is good. That's
no
right.
spread is good.
I told you that. I've told you guys. Stable is good. That's good. That's kind of really being imparted.
And that we have really, one of the favorite things I have to say is we have a medicine for just about everything. So if we determine that it's spread to their bones, then we have, we have our Zometa, we have our, Exgiva.
Right.
We will treat as best we can. We may biopsy the site to make sure we're choosing the right treatment plan. But scans are something, patients get very anxious about scans and tumor markers.
Right,
They kind of hang on those.
A lot of my colleagues don't even do tumor markers for that reason. I tend to be a little bit different. I mean, I tend to look at symptoms, tumor markers, and scans. Because oftentimes the scans are kind of the same, maybe a little bit different, but not that bad, and the markers are going down. And it's very satisfying to tell somebody, look, yeah, the scans kind of look the same, maybe a touch worse, but your markers are going down, so it's likely your cancer's getting better. Right. And I think that I tend to use that. A lot of people don't like tumor markers. They think they're just hocus pocus, but I personally, in my practice, tend to use them.
Well, I think we see the correlation. I think there's enough correlation that
exactly.
it's merited to keep an eye on.
Right, and I think the idea, again, in metastatic cancer that we try to do is that, we try, because people live so long with it now. I mean, again, we're talking HER2-positive cancer, at least 5 years, or not longer. Probably ER-positive metastatic disease, probably longer than that, 6, 7, 8 years, in our practice. And I think that, what we try to do is give people as good a quality of life as long as possible. Like leaving people on chemo forever just doesn't do it. They always run into problems. And again, I mean, it's really good. And one thing that we have in our practice that about is that we have a nurse practitioner who's been very involved in symptom management for breast cancer forever. She made an academic career out of it. And so one of the things that I think we found, and we've kind of imparted on everybody, is the importance of coming in every month or every other month. And you think that's important for patients to come in with some frequency? Because we're now actually trying to have people come every 3 months. There's a big movement now because some of the drugs like Zometa are now being given every 3 months, not every month anymore.
We tend to do that with our more stable patients.
Correct.
Especially, it's usually after scans.
But I think there's something But I think there's something about people wanting to come every month. Have you found people want to come in every month? Or they don't like it, they want to come in every less frequently?
I think it's a case-to-case basis. Some patients, it's, it can be a financial concern, the co-pays. Also, it could be an emotional need. They need someone to tell them you're doing fine. Exactly. So they like to see somebody every month.
Well, they do like the internet. I always have the internet available.
Yes.
Too,
but one thing we've learned through our coworker who does a lot of work with metastatic is that there's so many needs beyond the medical.
Correct. That's the point.
It's again, it can be financial, or they need to work, but the side effects of their drugs prohibit them.
Fatigue in particular.
Right.
Right.
So I mean, it's multifaceted, and we try to cover all those bases, and we involve palliative care, we involve social work, and we try to make it as I don't want to use the word easy, but as doable,
Stress-free.
stress-free.
Yeah, no, I agree. You have enough stress having, something in you that is probably not curable, and I agree. And I think that's a really important point. And I think as we as a group of oncologists try to move out the visit frequency, of women now from monthly to every couple months or every 3 months. I mean, these are the things we have to keep in mind.